Parents, imagine this. Your teenage child has been struggling and suddenly she can't walk, she can't talk, or having this episode that looks like seizures. And of course you freak out and then you take your child to the ER, and then ER doctors run 10,000 different tests, including scans and blood work and things like that, and they can't find anything. So they are basically saying, well, we can't really find anything wrong with your child, so we're going to send you to an inpatient psych unit, which is inpatient psychiatric unit, for something called conversion disorder, because what your child is going through is severe and we need to treat this right away. As a caring parent, you're like, oh my gosh, first of all, what is conversion disorder? What is FND? And what do you mean? My child does not have any behavioral problems? I mean, she's just a good kid. What are you talking about that she needs to go to an inpatient psych unit? But you are a diligent, dedicated parent, so you are not going to say no to the doctor's orders. So you basically follow along, and next thing you know, your child's condition is getting worse and worse and worse and worse and worse. Now your child is as debilitated as she can be, and then you are like, OMG, what have we done? If this is you, I want to say you're not alone, and I'm going to talk about something that most people don't talk about, which is this. Inpatient psych unit is not the solution for teens with FND because they are not designed to resolve FND. So in today's video, I'm going to talk about why inpatient psych unit is not the answer for FND and when to potentially consider an inpatient psych unit for your child. So let's dive in. So who am I talking? My name is Dr. Lee. I'm a pediatric health psychologist and the founder of Teen FND Academy, which is an online group coaching program to help teens with FND and their parents basically get their lives back. Which, by the way, if you're enjoying this video, please hit subscribe and like button and make sure that you share this with everyone on the planet that you know. But along the side, I have had over close to probably at this point 30 years of experience working in the mental health field, including inpatient psych unit hospitals. And let me tell you, let's start with the basics, okay, of what FND is. First of all, functional neurological disorder, short for FND, is a biopsychosocial phenomenon. It is not just psychological issues, or it is just trauma, anxiety, and stress and things like that. Conversion disorder is an old term to describe FND, and it used to be considered a pure mental health disorder like what I was talking about. Oh, it's just a stress. Oh, it's just an anxiety. Oh, it is a psych issue. Oh, it is a trauma. So all you do is a psychotherapy and then you're going to get better. Fast forward, FND is not the same thing as a conversion disorder, and this is number one big misconnect that we have with bunch of providers because they still think it's the same thing. So going back to FND, yes, I want to clarify stress, anxiety, and trauma. Yes, they do matter. However, so does the nervous system wiring or miswiring, behavior patterns, environmental situations, social expectations, biological components, all of those things, they all matter for FND. It is not malingering. It is not the same thing as making things up. Your child's doing is for attention and things like that. It is a real, valid, and treatable and reversible condition. So that is that. Okay, but only with the right approach. So let's move on to why inpatient psych unit is not the solution or don't help FND for teens. Well, number one, most inpatient psych units are designed to focus on medication stabilization and then risk prevention. So they are specifically designed for managing high-risk behaviors such as suicidal, homicidal, ideation or attempt or intent, and very unpredictable mood instability or any other safety concerns. It is not designed for skill-based program, which is what is required to be done with FND. So there is that. They're definitely not designed to help with FND. And I have worked with incredible staff members who care about their patient and all of that. However, here's the deal. These staff, most of them are rarely trained in FND specific care. So teens may feel dismissed at best or mislabeled as manipulative. I had a conversation with so many families who sort of got sucked into this, I don't want to say scam because obviously hospital settings are not scamming, but they got sucked into this treatment opportunity or option as if that was the answer. I mean, after all, why would they even doubt their treatment providers' recommendations, right? However, the staff members at these inpatient psych units are not necessarily trained in FND. Therefore, they usually think that they are dealing with teens who are behavioral, I would say air quote, manipulative, or trying to basically get out of the system. So these staff members can be sometimes pretty strict or for some people harsh, right? Because they are having very strict boundaries, going with the protocol that is not really designed for FND, as I mentioned, but they don't know how to differentiate what is FND or what is not, because again, they don't have any training. And oftentimes when these kids are on the inpatient psych units, families are rarely involved, if at all. I mean, zero family involvement is usually the case. Occasionally there's a family meeting, occasionally parents can reach out to the staff member every once in a while. Sounds almost like a jail, right? But especially with teens with FND, the parents' involvement or family involvement is essential in FND recovery. You just cannot separate. Once again, unlike other traditional psychotherapy, FND recovery is not something you parents can just drop off your child and then hoping the therapist is going to fix their child. No, that is not how it works. Parents, your involvement is absolutely essential. So you kind of need to know what to do and what not to do. But inpatient psych unit, rarely that is the case. And earlier I said sending teens to these places like inpatient psych unit will do more harm is this. Because at the end of the day, teens may leave feeling more confused, maybe more ashamed, or super helpless because they are surrounded by other teens who are actively behaviorally aggressive and actively mood-wise super unstable and things like that. Not that there's anything wrong with these kids, because these kids are there for a reason, and that is what the inpatient psych unit is designed for. And it sounds really scary, but can you imagine your teen suddenly not able to walk because of FND, just put randomly into this inpatient psych unit surrounded by other teens which have nothing to do with your teen, feeling super confused and angry, sad, not knowing what to do, and then feeling helpless and maybe ashamed, guilt, doubtful, all kinds of feelings. I can only imagine that. And then here's the deal. You cannot talk someone out of FND. That is not how it works out. You have to retrain the nervous system and then rebuild the real life recovery skills, not talking someone out of FND. So let's talk about when it is a good time or might be necessary to consider inpatient psych unit. So here are the lists, and I'm just going to read off of it. As I mentioned, inpatient psych unit is designed for specific things. So if your child has FND and there is a mental health crisis, such as intent or unsafe behavior, then that might be another reason to consider inpatient psych unit, not because of FND, but because of the mental health crisis. And the other thing is, if your teen needs a medical monitoring during a dangerous FND flare-up. So what does that mean? Let's just say that your teen is at home and there is this massive FND flare-up episode that is out of control, and then you are not able to handle that crisis all on your own. Either your teen is being very aggressive or hurting themselves or needing some sort of medical stabilization, then that might be the right step to consider the inpatient psych unit option. Again, not because of, well, my teen has an FND and then she's paralyzed, therefore she needs to be in an inpatient psych unit. Not just that. Or the inpatient psych unit option might be reasonable when we talk about a short-term safety measure. So, okay, we need to come up with the plan, but we need to figure out what the plan would be. So this is not going to be a long-term FND recovery strategy at inpatient psych unit. However, wow, things are out of control because my child continues to be very aggressive physically, and it's just not safe to be in that house environment at the moment. So let's give a few days, very short, quick term, to stabilize and come up with a safety measure for that long-term FND recovery. Now, inpatient psych unit may or may not be an option. However, here's the deal, only if the team of the inpatient psych unit understands FND or you have a clear plan for recovery afterwards. Otherwise, you might be told that this is a med psych unit, as I mentioned earlier, and yeah, your child is going to get PT, OT, speech, and blah, 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 with psych support and all that kind of stuff. Great. But if that program is not designed for FND recovery, non-FND rehab, PT, OT, speech are not necessarily going to be super helpful either. Same for the psych support. Again, FND is not just a mental health issue that is caused by anxiety, stress, or trauma. So having a regular counselor, again, there's nothing against these people. They're just not specialists. But having a regular counseling session, let's just talk about your emotions, aren't going to do much for FND. I'll tell you that. So you might consider these inpatient psych unit options with the discussion with the doctors. However, the bottom line is if the team has absolutely no clue about FND, then is that the only place? Is that the first place that I would think about? Probably not. Again, that doesn't necessarily mean that all of these inpatient units are bad. There are perhaps some inpatient rehab specific unit, not necessarily inpatient psych unit, right? So I'm specifically talking about the inpatient psych unit here. So what then? If inpatient psych unit is not the answer, then what could be the answer? What does your teen with FND actually need instead? So let's talk about that. Number one, education. You and your teen absolutely need to be educated about what FND is, because again, if you're like other families being told FND is the same thing as a convergent disorder, so psychotherapy is the only answer, not really the case. Okay, so you really need to know what it is, and your teen, along with you, need to practice daily routines, regulation, responsibility, recreation, which I talk about the daily menu plan, the 3 R's, after knowing what FND is, right? And then you, as a parent, need to be heavily involved as partners in recovery. Not the same as you're going to take over and hover over and have a clipboard chasing after your child, logging every single episode. No, that is the very first thing in my online coaching program to say, don't do that, okay? After the parents are involved, you and your teen absolutely need this step-by-step methodology of how to get from here, A, to Z in a systematic manner, so then you have some plan in place. So I always use this thing called the Brain for Teens methodology in my program, Teen FND Academy, that walk you through the step-by-step, practical, active skills. And more importantly though, at the core, you and your teen need to accept the FND is a diagnosis among all the other things that might be happening, and believe your ability to heal. If you are super hopeless and helpless, then that is a place you want to work on, because no matter what other people say to you or your teen, FND is chronic, this is something you have to live with. Well, it's up to you if you want to believe that, because I have seen one too many times that those teens who were told this is chronic, permanent, completely reversed that and then got their life back. Therefore, I am 100% positive FND is something that can be worked towards a recovery. Now, if you're being told that inpatient psych unit is the only answer, then I would say pause and ask yourself this question. Does this place understand FND? If the answer is yes, you're in luck. If the answer is not, then you're risking sending your teen down the wrong path. Now, on the other hand, if you want a real long-lasting recovery with a structured way forward with your teen at the center along with you, then you might consider Teen FND Academy, my program. The link is down below, and apply for the program and see if you qualify for the program. Now, thank you so much for watching this video. And for those who are out there who's been sending their child to ER and or inpatient psych unit, don't feel bad, because now you know what not to do and when to consider those places. And I'll see you next time.